And hundreds of viewers have been sending in questions about the COVID-19 outbreak, and we're working hard to answer them with the facts. Our first viewer question: since a plane's cabin is constantly circulating air, will I get sick if someone else on the flight is sick and coughing? We asked Dr. Frank Lavecchia with Valleywise Health Medical Center.
You know, commercial airlines are often thought to just be circulating the same air, and the person who breathes next to you is going to come back on an intercontinental flight, 10 or 15 times. Not totally true. Half of the air that comes in or more is from the outside. So you are getting some fresh air. With that said, of course, plane is a high-risk area because of social distancing, etc. I've seen patients and people go in and wipe planes down when they walk in, try to stay in their seat. I think it's not a bad idea to wipe things down until we have a further understanding of this virus.
And our next viewer question: do those plexiglass barriers at grocery stores really stop the spread of COVID-19? We asked Dr. Andrew Carroll, who sits on the board for the American Academy of Family Physicians.
I think they sure can if they're built right. So if they're high enough to protect the person, and let's say you're talking to them, and we know that the virus actually transmits through respiratory droplets, even with something as simple as talking. So if there's a barrier that goes above them and above you, then yeah, it works great. But what I saw happen the other day is somebody was sneaking their face around the barrier to talk to the person. That's a big no-no. That totally eliminates the purpose of that guard. So when you're talking to them, let the plexiglass be your barrier. It helps you and helps them.
Great advice. Thanks to both doctors. Remember, we want to answer your questions, so please post them on our Facebook page or text us 602-444-1212. You can also download our 12 News app.